inflammation play in diabetes?
Well, inflammation is actually the most difficult problem that diabetic people have to overcome. It is actually the way in which disease starts. Almost all diseases have an inflammatory response. Inflammation takes place when something called an inflammatory cytokine tells the body, I've got problems. Now, a normal person who can burn carbohydrate does not have a lot of free fatty acids. You see, if you're burning carbohydrates, your body automatically reduces the free fatty acids in your blood. Okay. Now, the endothelial cells, which are all the little cells that line everywhere you hold blood in, they hate free fatty acids. And so when endothelium have a presentation of free fatty acids, they say, help! And so they call for an inflammatory process. In other words, they think they're in trouble, and whenever cells think they're in trouble, they call for help. And the way the help comes is with something called inflammatory cytokines, tumor necrosis factor alpha, nuclear factor kappa beta. These are all inflammatory processes that are good for you if you're fighting bacteria or you're fighting a wound, you got staph infection. This is good stuff. This is how you fight off things. But if you're a diabetic and you're calling on this inflammatory response all the time, because your endothelial cells say, oh, I got this free fatty acid, I'm in trouble, then that's why diabetic people have so much trouble, because the way in which your body is designed is like two tides.